Welcome to our presentation on other health impaired and orthopedic impairments, including visual impairments, when thinking about eligibility and special education services. When a child meets the criteria for a defined disability, they have rights that are met under the Individuals with Disabilities Act, also known as IDEA. This is a law that ensures that all children, despite a disability, have access to a free and appropriate education. We're going to talk about what guides disability eligibility and some of the implications that come with that. When defining disability under IDEA, there are 14 categories that can be used to help determine a child's eligibility for special education supports and related services. These include autism, deafblindness, emotional disturbance, hearing impairments, which include deafness, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disabilities, speech or language impairments, traumatic brain injury, visual impairments including blindness, and developmental delay, which is appropriate for children up to age 8. In this presentation, we will be focusing on the categories of other health impairments, also referred to as OHI, and orthopedic impairment, or OI, including when there is a presence of a visual impairment or blindness. We will include the process of determining eligibility as well as some of the implications for educational planning when a child qualifies with one or more. It is important to distinguish between a diagnosis and a disability in terms of eligibility for special education and related services. This is especially helpful in helping parents understand the process of eligibility determination for special education. The term disability is used to determine eligibility for special education and related services based on a team decision and refers specifically to how the individual's access to education is impacted. And the term diagnosis is based on a child's medical condition that has been given or diagnosed by a medical provider. An example that helps distinguish between the difference of a diagnosis and a disability is if when thinking about a child with a medical diagnosis of cerebral palsy or CP, when the team is working on determining eligibility, they may be looking at the disability category of orthopedic impairment due to the physical impairments that are likely to be present with the diagnosis of CP. Something else to consider is that when a child has a diagnosis of CP, there may be more eligibility categories that are also appropriate, depending on the individual's unique developmental and educational needs. This may include something like visual impairment. On the next slide, we'll be able to talk more about what criteria is considered when deciding what is the appropriate disability category for an individual. According to the New Mexico Team Manual, it is necessary to ensure that during the EDT meeting, also known as the Eligibility Determination Meeting, the team clearly documents, based on the assessments that were used and the eligibility category that will be used for qualification, that a child demonstrates a need for special education and related services because, as a result of that disability, the child requires specially designed instruction in order to meet these 3 criteria. First of all, we need to be able to document that the disability has implications in how the child can be involved in and make progress in the general education curriculum, or for younger children that may be in preschool, to be in the ages of 3 to 5, to be able to participate in appropriate activities with their peers. Second, to be able to participate in extracurricular and other non-academic activities. And finally, third, to be educated and participate with other children with disabilities and non-disabled children. So when we're saying that a child meets a certain eligibility category, or disability category, we must be able to say that these three factors are impacted by that disability. As defined by the team manual, other health impairment, or OHI, refers to an individual having limited strength, vitality, or alertness, which includes a heightened alertness to environmental stimuli. That ultimately results in a limited alertness with respect to the educational environment that is due to a chronic or acute health problem that adversely affects a child's educational performance. It is important to remember that just because an individual has a diagnosis that falls under the common conditions for a specific eligibility category, it doesn't mean that they automatically qualify for special education supports and services. It's important that the team makes the decision that the diagnosis affects the individual according to the three criteria for eligibility that we discussed earlier. Some of the common conditions, according to the team manual, falling under the OHI category include asthma, ADD, ADHD, diabetes, epilepsy, heart conditions, hemophilia, lead poisoning, leukemia, nephritis, sickle cell anemia, not to mention many other syndromes and other health medical conditions or medical procedures that children may experience. Like I said, there's many other diagnoses or health conditions that potentially have implications and could be considered for this eligibility category. Children that meet the qualification of OHI may frequently miss school due to their medical needs, have pain or discomfort, fatigue, or just have a difficult time focusing, which would require specific modifications and adaptations for the child to be successful in the educational setting. The next eligibility category that we're going to look at is orthopedic impairment, also referred to as OI. As defined in the team manual, eligibility under the category of orthopedic impairment is based on a severe orthopedic impairment, which would be physical or structural, that adversely affects the child's educational performance. Orthopedic impairments may include conditions that have been caused by a congenital anomaly, which is a genetic factor or something that a child had been born with, which impacts the orthopedic development of the child, or could be caused by an acquired complication from a disease or other medical situation. An impairment could also be caused by other factors such as cerebral palsy, fractures, burns, amputations, anything that really impacts the physical body. OI would be an appropriate eligibility category for special education services when a child's impairment adversely affects their ability to be involved in and make progress in the general education program due to chronic, physical, or structural limitations of the body, which includes the skeleton, joints, muscles, and fascia, which is the connective tissue beneath the skin. When thinking about the educational implications that are related to OI, the team can think about these factors in regards to how it impacts the child in their daily routines at school. Think about how the child can access general education curriculum in classrooms. Do they have the ability to safely navigate the campus? How about the ability to utilize school resources such as playgrounds, libraries, restrooms, the cafeteria, or anywhere else on the campus? What about the ability to participate in all activities, including physical education? These are things that we want to think about when serving a child with an orthopedic impairment. So now we're going to talk about visual impairments. According to the New Mexico Team Manual, the disability category of visual impairment refers to a child's vision that is impaired in a way that, even with the best correction, adversely affects the child's educational performance and involvement in the curriculum, including extracurricular activities and other developmentally appropriate activities. This eligibility category is appropriate for children that fall anywhere on the spectrum of a visual impairment, including from partial sighted to blindness. Visual impairments will vary greatly between each child. Also, visual impairments, which include blindness, can impact development in other areas such as physical or motor, social or emotional. It will affect learning opportunities, including pre-academic and academic activities, depending on the age of the child. So it's important to just be able to figure out how to use assessments to distinguish between the needs that are based on the visual impairment versus the needs that are based on other impairments. So far, we've talked a little bit about the factors of the 3 eligibility categories. It's also important to consider how each person that is a part of the EDT or IEP team has a role in the decision-making process. Each team is going to look unique depending on the specific needs of the individual student or child that is being assessed and working towards eligibility and an IEP. The team might consist of professionals such as diagnosticians, physical therapists, occupational therapists, speech therapist, special education teacher, general education teacher, TVI, O&M. It's critical to always remember that the role and participation of the parents and the child are also an important part of the process. Now let's talk about what guides the decision-making process for eligibility. There are 2 questions that need to be asked. Is the child a child with a disability as defined by IDEA? And secondly, does the child demonstrate a need for specially designed instruction as a result of a disability? The team manual is a tool that can support asking and answering those types of questions for each of the eligibility categories. Sometimes the professionals on the team must make a professional judgment, and this is why it is critical to ensure that the right people are on the team, depending on the individual's specific needs. For example, if a child has a visual impairment or a medical condition or diagnosis that puts the child at risk for an impact or effect on functional vision, a TVI and or an O&M should be an active part of the team. All of the assessments that are used to aid in the eligibility process will provide information and data to support the decision. This is why it's also very important to ensure that you use appropriate assessments for children with visual impairments and or multiple disabilities. If a child has a visual impairment with or without other impairments, it is critical that the appropriate professionals be on the team for evaluations and assessments, as well as when eligibility decisions are made. Something to consider is asking what the child's primary mode of instruction is, such as a visual, auditory, or tactile learner, as that is very useful information in understanding the adaptations that are needed and may potentially help to determine a child's primary disability. This could aid in the challenging work of determining which disability should be considered primary and which should be considered secondary. Even when a visual impairment is a secondary diagnosis, it may play a significant role in what accommodations are needed to best meet the children's needs. Professionals on the team should be able to explain how a visual impairment and other disabilities will influence assessment outcomes, and then be able to support appropriate accommodations and modifications to the educational environment and curriculum.